Hi, I'm Petra Nobel. I am a certified postpartum doula, and I'm also a certified infant and child sleep consultant. I work as a postpartum doula and as a sleep consultant. I have been a postpartum doula for most of my working life. First as a maternity care nurse in the Netherlands, and now here in Canada for the last 8 years, I believe, and a sleep consultant for the last 4 or 5 years. Yeah. And I'm also the instructor for the Dutch Infant and Child Sleep Consulting Program for the International Parenting and Health Institute. I would first tell them to be patient, and they are doing a really good job with just doing what they are doing right now. Make sure that they are latching on the baby as often as the baby wants and as long as the baby wants, because the more you breastfeed, the better milk production will be there. So yeah, just keep going and it will come. Latching on a baby, that can be so hard and can be really tricky. To latch on a baby, just how to understand how to hold a baby correct, how the baby is latched on correct, and how to latch the baby actually on correct. So although a lot of them are doing breastfeeding classes before they have a baby, while they are still pregnant, when you are holding your baby and when your baby is crying and screaming, you need to latch your baby on, it can be very tricky. Well, when a baby latches on incorrectly, that often results with sore nipples and everything that comes with it. And then at the same time, if a baby doesn't latch on correctly, milk production is not the best it can be. So yeah, then you start dealing with sore nipples, with pain everywhere, with milk that might not be removed from your breast correct because your baby is not latching on correct and not getting all the milk that is there for the baby. So yeah, those things can be very, very tough. Yeah. No. A lot of them do feel that they cannot support their partners the way their partner wants support. It's also like all of a sudden you see your partner in a totally different role, and that's actually for both of them. All of a sudden your partner is a parent to this little baby. And then as a man, most men are all of a sudden getting this feeling like, okay, now I need to provide because now I have a partner and a child. So now I need to provide. So they start really focusing on work when they are really, or not, I'm saying that wrong. The work becomes really important and they feel like they need to do better and more and get, well, the main source, more money in to provide for this new baby and mom, but also support your partner while like breastfeeding in the middle of the night. If the mom is breastfeeding the baby and the dad wants to help but feels really bad that he keeps sleeping through the night, through the crying of the baby, and in the morning doesn't really realize how often mom has fed the baby, and mom is sort of like, oh, I fed the baby many times and you just kept on sleeping. So that's one of the things that men have to deal with, and they really do find hard. You often see men, new dads, really dealing with anxiety and maybe postpartum depression, because it is overwhelming for them too, and they also have lack of sleep, lack of social activities, like their life is changing also. I really think that for a lot of men, just a change of relationship with their partner, I think that's the even bigger one, because there's some part of their social life that's still sort of the same, because often men still get a chance to go to work outside of the house. So they might get a lunch outside of the house and maybe a little bit of downtime or time by themselves, not saying downtime, time by themselves without a baby in the background. So I think it's more like the the relationship with their partner and the responsibility that comes with it, with having a baby and a partner that is on mat leave. I think people need to really listen to what other people are saying. Like if they say I'm tired, it's not like yeah you're tired, but it's like understanding how tired somebody can be who has not have 8 hours of sleep in one stretch for weeks or days in a row, who's been waking up 2, 3 or often more times a night. Like really listen to what somebody is saying, but also observing. Like if you know that somebody is a certain way and all of a sudden somebody shows really different behavior, you need to think about why that is. And when you ask somebody, can I help you, you need to listen what somebody is saying. Like if they say yes, please help me, then yes, please help them. And even if people are saying, can I help you, and they say no thank you, I'm fine, maybe you should change your question. Maybe you should ask, what can I do for you? Would you like me to cook something for you, like cook a meal? Or when I come over this week, can you please leave the laundry for me? Maybe you need to change things when you ask them if you can help them. Ask the questions differently. Ask her what she wants, listen to what she wants, watch for what she wants and needs, because sometimes often they will not speak up what they want, but there are things that they need, like rest, like sleep. But if she wants to hold the baby and she wants you to clean up the kitchen, yeah, that's needed too, because then when she will come downstairs or be ready to get something to eat or cook for herself, it's nice when she can just go and get what she wants. Yeah. I think it's harder because we don't have the support from our mothers or our sisters, because a lot of women are working these days, working outside of the house. They have jobs, they have commitments. So you have your baby and you're sort of on your own. Your partner goes back to work, you're on your own, and then you don't really see, many people don't really watch somebody else feed a baby or take care of a baby or hold a baby or breastfeed a baby. So we used to learn from our mothers, our sisters, and any other women women in our community, and that's not happening anymore. And then there is social media, because everybody shows on Instagram their perfect life, but they really only show what's perfect. They don't show what's not so perfect in the middle of the night, when you're tired at the end of the day, and when there are laundry baskets full of laundry that need to be folded. So nobody shows that, and that's, women are looking at, oh, look at her, she's doing it so well, she's looking great, and look at me, I'm still in my maternity pants, and I look like I'm still pregnant. So they put a lot of pressure on themselves. I'm not even sure if you can do that. I think it needs to come from a different angle. I think it needs to maybe when midwives and doctors are being educated, maybe it needs to go into their education, that they need to have an understanding for women in birth, that for how they explain, how they work with women during labor and delivery. Because when you are with a midwife, it's a little bit different, because you often have the midwife that are taking care of you during your pregnancy, who's also going to be there at your delivery, at least one or two of them, so they get to know you. With a doctor, they might not be there in the delivery room because they are on call. So you might be delivering your baby with a total stranger or somebody that you haven't seen that often. So there's no relationship. So I'm not sure how they can work with that. It would be great if you can have some pointers, like like a birth plan, but then really to the point, and so that they understand when they come in, like, okay, this lady really likes to be informed and really likes to know, really wants to know what is going to happen, what are the next steps, and if there is time, she wants to be able to think about that. But I actually believe that they need to learn and understand patients in a different way and work with patients. Not only labor and delivery, I assume. I think doctors overall might need to get a different understanding of how they work with their patients.